Is joint inflammation always a sign of arthritis? Have you ever wondered if joint inflammation means you have arthritis? It is a common question, and the answer is not as straightforward as you might think. Joint inflammation can indicate various conditions, and while arthritis is a significant cause, it is not the only one. Joint inflammation occurs when the tissues around or inside a joint become swollen, tender, warm, and often painful. This can happen for several reasons, and not all of them are related to arthritis. Arthritis is a term that describes a group of conditions that involve joint inflammation and pain. There are two main categories of arthritis. The first is inflammatory arthritis, which includes diseases like rheumatoid arthritis, psoriatic arthritis, lupus, gout, and ankylosing spondylitis. In these conditions, the immune system mistakenly attacks the joint tissues, leading to inflammation and pain. This inflammation is caused by immune chemicals that irritate nerves and tissues inside the joint, resulting in symptoms like stiffness and swelling. Early diagnosis and treatment are essential to limit joint damage in these cases. The second category is osteoarthritis, which is the most common type of arthritis. It is primarily caused by wear and tear on the cartilage that cushions the joints. Although it has traditionally been viewed as a non-inflammatory condition, recent research shows that inflammation can occur in osteoarthritis as well. This inflammation usually happens in the joint lining and contributes to pain and stiffness, but it is often a secondary effect of cartilage breakdown rather than a primary immune attack. Besides arthritis, joint inflammation can also arise from other causes. For example, infections can lead to joint inflammation, known as septic arthritis. Injuries can also cause temporary inflammation in a joint. Other inflammatory conditions that do not primarily involve the joints can also result in joint swelling and pain. So, while joint inflammation is a hallmark of arthritis, it is not exclusively caused by it. Inflammatory arthritis involves immune-driven inflammation affecting multiple joints, while osteoarthritis involves cartilage damage with possible secondary inflammation. Other causes of joint inflammation exist, so it is essential to understand the type and cause of inflammation for proper diagnosis and treatment.